Despite its disappointing and troubled start, Medicaid privatization is moving forward. We've been told the problems, the conflicts of interest, and even apparent threats to the continued care of disabled Iowans who will be having this service, and that'll be worked out soon. And I think we all certainly hope that it will. If everything is ready April 1st, it will be the first major deadline that the program has actually met. The Human Resources Committee is bringing the Medicaid oversight legislation before you today with the unanimous support of our Republican and Democrat members. That task before us now to protecting Iowans with tough bipartisan oversight and accountability is here. Our job is to protect the health care safety net for Iowa families. We are all one accident or one illness away from being on Medicaid and depending on it for our health care. Iowa's health care safety net is simply too important to turn over to out-of-state corporations. The intent of this legislation is to safeguard the interests of Medicaid members, encourage the participation of Medicaid providers, and to protect Iowa taxpayers. In addition to vigorous government oversight with significant stakeholder involvement, we must require DHS and the managed care companies to protect consumers, preserve provider networks, address the unique needs of children, and assure accountability. We must also ensure that Medicaid dollars continue to make system improvements. Here are the ways Senate File 2213 will accomplish these goals. First, enhance the role and responsibility of the Health Policy Oversight Committee. 2, execute a comprehensive review of program integrity. 3, create a Medicaid reinvestment fund which will finance system improvements and fund the Ombudsman program. 4, assign duties and authority to the Managed Care Ombudsman program. 5, expand and enhance the Medicaid Assistant Advisory Council, otherwise known as MAC. And 6, direct DHS to make specific improvements in the area of consumer protections, children, provider participation enhancement, rates and payments, data collection, and evaluation, and specifically oversight. It is undeniable that Governor Branstad took a too much, too fast approach to Medicaid privatization. That's why the federal government imposed 2 delays. Much more importantly, that's why Iowans are repeatedly, urgently speaking out. Every legislator in the Iowa Senate and the Iowa House, every legislator in both political parties has been contacted by those very Iowans. There are too many unanswered questions about who will provide oversight and how and where these individuals are going to get services. This Medicaid privatization program is destined to harm the very people it was supposed to help. Apparently, it was designed by those who know the cost of everything and understand the value of nothing. This legislation is our bipartisan response to those concerns.